and also anchor us back in the fact that this is World Obesity Day. This is an important day for those of us that work and kind of see a bright future for the world of obesity and obesity care. So it's a great day for us to be talking about obesity and hopefully making it easier and a little bit more comfortable for you to do the same. Our next session is going to pick up exactly where we were tracking to before and talking about that engaged patient, that really informed and empowered patient. But now we're going to also add in that layer of being with a physician that is truly in it with you and about that patient and physician partnership in action. So joining us now is Dr. Shabina Walji, who is another real-world example of the impact of the informed patient and what the future of care can look like in Canada, because she is a fantastic healthcare provider that we have in our world. Yay! Hi, Dr. Walji. So nice to
Hi,
see you.
thank you
So
for
Dr.
having
Walji,
me.
yes, of course. Dr. Walji obtained her medical degree from McMaster University and her family medicine designation from the University of Toronto. She's another one of those very fancy diplomats of the American Board of Obesity Medicine. I cannot stress enough that we need more ABOMs in the world, and I appreciate that that is something that you have done. And Dr. Walji also co-founded the Calgary Weight Management Center, which is a lovely multidisciplinary clinic offering sensitive, comprehensive, and evidence-based care to patients trying to manage their weight and weight-related issues. So, Dr. Walji, so great that you are here. You are also a co-author in the primary care chapter for the Canadian Obesity Guidelines. We are lucky to get your time today. But I would love if you could just say hello, introduce yourself, and maybe tell us a little bit about how you got into the world of obesity care as well. And then
Oh,
we'll tuck into some of the examples that you're here to share with us.
yeah, sure. Well, first, I just want to say thank you so much for inviting me to be here today. This is really exciting and it's new for me too. So I am a family doctor by training. I was just doing the math and I've been in practice for 22 years this year.
Nice.
I It's a little weird when you can say it's been more than a decade, and for me, it's been more than two. Um, I practiced as a family doctor for about 6 years. And the whole reason I got into family medicine was because I was really um, just enthusiastic about health promotion. And as a family doctor, you see a little bit of everything. You see some mental health stuff, you see osteoarthritis, you see sleep apnea, fatty liver, diabetes, high blood pressure. And, a common recommendation was lose weight. This is what I was taught in medical school, however many years ago, just tell your patients to lose weight. But there was no education around obesity. There was no education around obesity care. And so very quickly in family medicine, I started to feel not just frustrated, but I'm going to say like I didn't have the skills to support my patients. And so that kind of inspired me to learn a little bit more so that I could better support my patients. Um, and so I tried to offer some obesity care in my family practice, but it was a little bit hard because as a family doctor, you're trying to manage so many different things. So it can be a little bit hard to be focused on just one thing. And so 16 years ago, we opened Calgary Weight Management Center here in Calgary. And so now our clinic has grown from one doctor. It used to be just me, but now we have several. And we have an amazing allied health team that just, they offer such, I don't know, I want to say sensitive care, for lack of a better word, sensitive and
Mm-hmm.
comprehensive care to our patients. And the work is so fulfilling. I have the opportunity to have these amazing relationships with my patients. And, it really feels like a partnership with every single one of them.
Mm, I love that. We need more Dr. Walji's in the world. All of them.
Yeah,
Fantastic.
absolutely. I think, this session, I was really looking forward to this particular session because the way it lined up with the rest of the conference and the things that we've talked about so far. But before we kind of dig into that stuff, I was wondering if maybe you'd be able to give us a bit of an rundown or of the example or the reason why I reached out to you to come and join. There's a very specific case study, I guess, that we'll kind of just chat about quickly.
Yeah, for sure. This is exciting for me too, because I never would have imagined that things would have gone in this direction. So I have this amazing patient. I'm going to call him Mike. That's not his real name, but I'm just going to call him Mike instead of saying the patient every single time. So Mike he's a 54-year-old man. He's married. He's got 3 adult kids. He works here in Calgary, and he was a high-level athlete in his youth. So Wade was. I'm sorry. I'm really hoping that you guys can't hear that, but I
Oh,
think
good.
that's wishful thinking.
Nothing to see. Carry on.
He was a high-level athlete in his youth, and so weight was never really something that he was too concerned about until he sort of transitioned into adulthood and kind of took on all the responsibilities that adulthood brings, and slowly weight kind of just crept up. He, had several attempts at weight reduction, and weight would come down and then come right back up. And then the pandemic really kind of, the way it affected so many other people, it just sort of exacerbated weight gain for him. And, over time, Mike started to develop some health concerns, like fatty liver and leg swelling and sleep apnea, depression, anxiety. And so it was really impacting his health and his quality of life. And so by the time I met Mike, he was very motivated by his health. Now, my approach when I spend time with my patients is really to spend quite a bit of time up front, just getting to know not just their medical history, but more about the patient's experience with weight, what their life context looks like right now, what their perceptions are, and that becomes a platform for a more in-depth discussion about biology, which is my favorite part, and I'm sure we'll talk about this at some point. But my goals at that first visit are to reduce internalized weight bias, debunk any myths that may exist, and then provide a platform for treatment options. And anyway, so Mike started working with our allied health team, and he got some amazing traction just with some behavior change that really caused him to feel better physically and emotionally, and he had more confidence. The reality, though, was that there were still these medical conditions that could have benefited from some weight reduction. So he was an excellent candidate for some pharmacotherapy. But the challenge was that he didn't have any coverage for it, and these medications, they're not cheap. Now, what I didn't know about Mike is that he's a go-getter. I had no idea because, I usually tell patients, why don't you talk to your insurance company and your employer and see what can be. Well, he took it a step further, and he found out who the decision makers were. He signed a consent for me to send them a letter advocating for access to care. And so I did. I wrote a letter, and I'm happy to talk about more what went into that letter. If you want to, we can talk about that after. But he took that letter and he took it to the powers that be. And about 5 or 6 months later, I got an email from him saying that his employer now covers obesity pharmacotherapy for all employees at this particular company. So this was really bucket filling for me.
Yes.
I had no idea that a letter could have so much of an impact. But I mean, I don't think this would have happened if it wasn't for Mike, and what a go-getter he was.
Yeah, and I had the pleasure of talking to Mike, and I really connected with him. I think we had a lot in common, and there was a couple things that stood out for me. But what I really liked about this example was this is something that we hear about all the time. I get emails and calls from people within our community every week on this exact topic. They've been prescribed something and they don't have access to it because it's not covered. And for the people that don't know, the way that it works right now with a lot of the insurance providers for medications, the obesity medications are they aren't in the standard formulary that most medications are in. They're put into a different bucket that is classified as lifestyle. And in this lifestyle bucket, the employer would have to buy that extra add-on to the insurance product that they're buying for their employees. So Mike, in this case, went to his employer and got it changed for everyone in the organization, which is amazing. And they decided to change their coverage for everyone. There has been some cases where people have reached out and they've done this on an individual basis where they've gotten an exemption or something like that when they
Yeah.
didn't have coverage. But this is way more significant because he changed policy across the board for his whole organization. So I was really, really excited about having this example be talked about here.
Thank you. Yeah.
It's so cool. And we just came off a session hearing from Melody, who had challenged the system and had BMI cutoffs reevaluated in the province of Nova Scotia as it related to breast reduction surgery. So this is such a lovely compliment to that, because she said a few times in what she just shared with us as well, like she high-fived with her GP because he was so proud of what they were able to accomplish together. So maybe let's tuck in a little bit more to this and talk about like the role that doctors have in advocating for their patients. And you feel free to use this real world example of Mike along the way as well. Like I know you mentioned the letter, those kinds of things. So what did that look like for you to genuinely be able to show up and advocate for a patient like that?
So, I mean, I think there's so much that physicians can do, and like from small things to big things, right? Like,
Mm,
I think there's a whole spectrum of support that they can provide. Like one would just be to use the right language, like use sensitive language, right? That just helps to, I think it nurtures the relationship more than I think we can appreciate. I think, and I don't think I realized how powerful this was until this experience with Mike and a subsequent conversation with Ian. Um, but I think providing education to your patients about, I mean, I do it. I do it every day, all day, providing education to patients about the biology of how the body regulates weight and eating behavior, about kind of how the body responds to weight reduction, the science of obesity. Um, whenever I'm doing it, I'm sort of trying to think, I want this patient to not feel biased. I don't want them to blame themselves, but I didn't realize that it could actually be empowering and help the patient advocate for themselves as well, right? To maybe take it that step further, right?
oh,
And then
that's
of course
huge.
it's huge, and I think I underestimated the power of that. So Ian, thank you for bringing that to my attention too, because I actually never thought about it that way and how it can impact the patient in that way. And then of course we can offer the appropriate interventions, without waiting for failure of one intervention before you talk about another one, right? Like offer the appropriate intervention at the appropriate time. And then I know those forms that we have to fill out, like you hear physicians grumble about forms a lot, but it doesn't take that long, and the impact is huge. So there's several places where we can help advocate for patients.
Mm. That's a really lovely answer to that, because it I have to say, in my mind, when we were approaching this topic, and you and I have had a few conversations about this session as well, it can be like, yes, of course, I'm going to support the care that I'm recommending for them. But just even those small pieces that you mentioned at the beginning really are moments of support and empowerment and advocacy. By not having a situation where you have to yell down the hall, I need a bigger cuff. Those moments
Yeah.
are actually really empowering and important. And we were chatting earlier as well with Dr. Sajwani, and she was talking about, having to say, I believe you to patients often in their initial intakes, and how we are, as a cohort of patients living with obesity, often feel like we have to come in with our dukes up a little bit, or we're prepared to not be heard. And the power of saying, I believe you, or I am in this with you, is monumental. It really is. So
Or
it's great
you
to hear you say that you didn't totally appreciate that either. Sorry, go ahead with what you were going to say.
No, it's true. I'm listening to what you're saying, and I'm just thinking about someone that I saw today, and you could tell she was a bit guarded. She was a new patient. She was referred, and it's not uncommon, I think, for patients to be a bit guarded because there's a full spectrum of experiences that our patients have with the healthcare system when it comes to talking about weight, right? Um, and as she's talking to me and I'm listening to her and I'm hearing her story, 100%, I think it's really important that patients feel like they're heard and that you believe what they're telling you. And that at the end of the day, you can say to them, yeah, this totally makes sense. It makes sense that this was, your experience. It makes sense that this is kind of where you're at. It makes sense that this is why it's hard. And I think that provides a lot of um, reassurance to the patient. I think it does wonders for that relationship too, right? And it really helps to form that partnership that you need to move forward.
Hmm. But you're right. It really does help with that shared burden sensibility as well. Because if you come in believing that this is all of yours, you created it and you have to fix it and you don't have those tools, versus having that moment where someone is with in it with you going, let's figure this out together. I
Mm-hmm.
always describe that as very sane making. It brought peace to my brain a little bit as well. Because genuinely, I was at a loss. I am a smart person. I know how, I have figured out a lot of things in life. How can this one thing continue to evade me or continue to be bigger than any of my other successes as well? Like it's a lot that you come in with as a patient. So to encounter a healthcare provider like you is optimal. This is what the future needs to look like.
Thank you.
And I
Yeah.
think to kind of just tie in again what me and you had mentioned or talked about previously about the informed patient and my conversation with Mike and how I was kind of well, he didn't know who I was at the time. He didn't know my background and my history and stuff like that. And he gave me a rundown of his story and what we shared so far. And I was really surprised at how he spoke, the language that he used, the key messages that he was talking about. They were exactly what we would have in our advocacy course or what we would talk about in our training for patient advocates. It was excellent, and so that's the type of stuff that empowered him to be able to ask those questions about who's the ones making these choices. And when he found out that the obesity medications were in that lifestyle box, he pushed back on that and said that's wrong because he was taught that that was wrong. So
Mhm.
awesome stuff.
It's
My
so
dogs are
important.
barking in the background, so I don't know if you'd hear.
I don't feel so bad now.
Yours sound a little bit bigger than maybe maybe the other dogs. All good. Everybody's reacting. Everybody's going, yes, we
Yeah,
feel
that's what it is.
I love it. So you mentioned that uh, the letter that you put together, but that you also had a really informed and empowered patient who was able to kind of connect the dots. And like, who would we send this letter even to? Might have been a question on your side of the fence. So maybe let's talk in real time and in real terms about like what that looked like, and maybe what was Mike's ask of you in that moment. Was it, can you write a letter saying I should get these medications? Was it as simple as that? Or
Let me remember. Okay, so it was during one of our encounters, and yeah, and we were taught this was after he found out that it wasn't covered. Um, and he, I think what he told me at that point was, I'm going to find out who I need to talk to have them reevaluate this. And then for me, it was just like magic. He came back the next time and he said, these are the people that I need you to write a letter to. Would you be willing to do that? And I said, Mike, I will do whatever you need me to do to help get this covered. So, yes, happily, I will write this letter. So I wrote the letter. I sent it to, of course, he had to sign consent for, and I sent it to. There were two parties that he asked me to send it to, but he did all the work. Like for me, I feel like the magic happened after the letter was written, um, largely in the hands of the patient.
nice.
I don't know if that's helpful, Lisa, because I feel like it's this big magical box. Like all I
No,
did was
well,
write a
and it
letter.
is. And it's kind of like obesity care. It's going to be individualized each time as well. I think, we're all going to need to figure out who it is that we need to connect with, but more importantly, have these kind of partnerships and relationships that we can turn to and say, let's add fuel to this fire. Let's figure this out together. And part of what we've been talking about today as well is we want to make sure people feel empowered, and educated and informed so they can advocate for themselves first and foremost. And then
Yeah.
if they're open to being louder, and helping the entire community. And at this point, I haven't met Mike. We had hoped Mike was going to be able to join today potentially. That hasn't happened, but that doesn't mean that this isn't still a building block that somebody else
Hmm.
can also look to as either a source of inspiration to keep going and fight their good fight, or something to literally, oh my gosh, that thumb, or something to point to and say, I know this is possible. Someone else was able to slow down and think about this, accept new information, and change the process. I am just asking for that same opportunity to be heard and understood. So I think it's all helpful.
So I think what I've really learned from this is how important it is for us to educate patients, public, about obesity, not just that it's a chronic disease, but why it's a chronic disease and how the body works. I think it's important to educate the public that there are evidence-based treatment guidelines, um, because I think that's where you get your confidence, to have those conversations and to advocate. When
Yes.
you know the science and you know that there's evidence-based treatment guidelines, um, you know, I think I think that is, they say knowledge is power. It
Mhm.
really, it really can be. So
It
then, so
really
then the
is.
responsibility falls on providers, to a large degree, to make sure that we understand the science and we are providing our patients with this information.
And that can be imperfect or incomplete information as well. And I want to just give a space for that for a moment as well, because there is new information. Everybody is individual. This is really complex. So I don't have necessarily a answer in the filing cabinet I can go to and say, here's how we fix that. It's that there's an opportunity to understand all of these different pieces and figure out what we can possibly achieve together. So I love that. And I think you're right. We have also heard it throughout the day today as well that, those spheres of support around us are equally important to be educated along the way. So I love the way that you said that. We need to empower and educate patients, but also the public at large, because we know that
Yeah.
that is noisy and that often can get our ear quicker than being in a room with Dr. Welch.
And I
Sometimes,
think
right?
one of the things one of the threads I kind of wanted to pull on a little bit here was and it's something me and Lisa have talked about, is that it is a partnership. We all have roles to play in this. So if we want to change something that has not been going well, so if we're talking about access to care or access to treatments, we all have a role to play. We can't just expect that our doctors are going to prescribe something and then that's going to be it. And if I don't get it, it's on them to. That's not how this works. And Mike's a good example of that. He took the initiative of finding out who he needed to ask questions of, and so depending on where that is, or where your barrier is, for Mike, it might have been his employer and the way that they set up their benefits. For other people, it might be going directly to the benefits provider. For other people, it might be the province because they're on a public plan or something like that. So there's different avenues for asking these questions and kicking doors in, but that's on us as patients. We can't expect that our physicians are going to be doing that for us. But if we make it easy for them, we do that legwork and we, come and get a really well written letter that has the right evidence and the right message, that could really turn the tide and make a difference. So that partnership is really important.
Oh yeah, for sure. And I think there's a lot that can be put, when I think about the letter that I wrote, there's a lot of stuff there that could be standardized in a
It will be.
letter that can that
We're
can
on
be
it.
taken to decision makers, with maybe a small section there to customize it to, a particular patient's medical situation, right? But a
Yeah.
good portion of the body of that letter can be standardized, I think.
Yeah. Yeah, and I think that's something that will definitely come away from this. Is, we've had letters previously, like standard letters for advocating to your employer or to like a union if you're part of a union, or to the insurance company, but those probably need to be updated a bit. And I think having those standardized letters is an easy step that Obesity Canada can do, and we'll have those for sure,
Oh,
because I
yeah.
think more people like Mike making noise like this, like he's made a dent in a big employer, a big organization, but there's thousands of those across the country that need to be changed as well. So we need more people being able to do that. So coming up with the tools to make it easy is something that we can do for sure.
And I wonder, sorry if I'm taking this in a different direction, but I wonder if, like, I'm a physician who does obesity care, and that's all I do, right?
Mm-hmm.
Um, but I wonder if letters for patients to take to their doctors, like their primary care providers, maybe physicians who don't do this work and maybe don't
Mm,
know, maybe there's even a step there to kind of advocate at that level, and then the second level would be to the employers, or I don't know, you know
Yeah.
but
absolutely.
I think there's a real opportunity here for some of the education to come from the patient. um, I don't know
Yeah.
what you think of that, but
You're totally on the right note. I know I heard from Ian very shortly after he got off the phone with Mike as well, and was like, okay, this is we found an awesome patient example here as well, as somebody who is empowered and informed and
he's
all of those different
awesome.
things.
Yeah.
But you're right, it has to start somewhere, and we very much are taking a look at all of those resources that we have available online, and we have an advocacy course within OC Connect that we offer as well. But you're right, sometimes it is even just that first conversation, or approaching that first conversation with our primary care or family doctor, and being armed with the right information. And I've said it once already today, and I'll probably say it 5 more times today, because everybody's entitled to their own opinions but not their own facts. So it really helps take
Yeah.
that any subjectivity away, as a patient to be able to walk in and go, I would like to talk about obesity care. Here is information that I have about the disease that I live with. I don't know what your level of insight or experience or exposure to this is, but I want to start having these kinds of conversations. Like,
Yeah.
even that would be a phenomenal first place to start. And also, we talked about today, and I'm sure we'll talk about it again on repeat as well, reminding patients that they have rights in this moment, and they have the right to ask questions, and they also have the right to say, is there somewhere else you could refer me to that is a more appropriate or more engaged in obesity care? And that isn't also going to be easy for everybody. We know we are a big old country, and we only have a
Mm.
handful of A-bombs like yourself, and we have a few obesity clinics and centers. So it's not that everybody can be referred either, but all of those things are about empowerment and advocacy and using your voice to feel seen and heard, to be able to get the level of care that you really need. So we know we're
Mhm.
working on that from the patient side. Is there anything that, from your experience or from your lens, that you would really like your colleagues or your peers to understand about supporting patients with advocacy efforts as well?
Well, for sure. I think, oh gosh, how do I make this concise and organized? There's a lot that I'd like my colleagues to know, from the basic, simple stuff. And you actually called out an example that I have witnessed before. And that was uh, having the right equipment
Mm,
in your office, in every exam room. I
yeah.
remember shortly 20 years ago, when I first started working in a family care setting, we had that exact thing happen that you mentioned, Lisa, where a patient was in a room and a nurse came out and yelled out, "Does anyone have the large cuff?" And I remember standing there thinking, that patient probably really doesn't appreciate this. I wouldn't.
Mhm.
So things like having the right equipment, the right gowns, the right chairs, the right reading material.
Yes.
Um, it's stuff that I take for granted because we do that at our clinic.
Mhm.
But I think for my colleagues, I think that's really important. Simple, easy advice. Using the right language, I think, is something I think that's very important for our patients. Oh gosh, should I run through my
Absolutely.
list of things that I think are important? I think, I think, and taking the time to talk to your patient. So if your patient comes in presenting with a particular symptom, usually you would do an assessment, and then based on that information, you would formulate your treatment plan. Um, a lot of times with weight, what I'm hearing is that there's no assessment piece. You know,
Mm,
there's no conversation about weight. You just sort of the patient will walk in. Maybe they'll say they want to talk about weight, and then the physician or the colleague will just jump to some sort of treatment plan without actually having the conversation. Um, or sometimes maybe the patient might not even mention weight, and not all physicians, but some, they might make assumptions and then
mm-hmm.
jump to a treatment plan and provide advice. So I think, treating treating the presenting concern the same way you would treat any other
Mm,
concern in medicine, you know, is it's an easy thing to do.
yes. Yeah. Yeah.
It's how we were trained. You have a symptom, you do an assessment, and then you kind of formulate your diagnosis and your plan. So use the same process you would with any other presenting complaint, I think, um, is key. And it's so powerful. And then my favorite is learn the biology. Like I learn the biology. It's empowering as a physician. Um, and it empowers your patients.
Mm-hmm.
I could go on with
There was
advice.
definitely a light bulb moment for me that when I learned about the biology, right? Like when I was able to express that to the people around me, because for me, it was almost like I was being armed with like this big shield. People would come at me, or they'd
Totally.
question me on what I was doing or the work that I did or the treatments that I was going for. And I had this big shield. It was like, I got facts. I don't care what you say, right? Like I know what I know, and you can either get on board. It's facts. So having that was really, really empowering and helpful for sure.
Oh yeah. I think I mean that's my favorite part. You can ask anytime I'm doing a talk to colleagues, anytime I'm talking with patients, I will tell them this is my favorite part, and I can go on about biology for as long as you will let me do this. Um, but I think there is so much power in the science.
There really is. You're very right in that. And I know we've alluded to the spaghetti map or the pathways map before as well, and how, you're that little person that's kind of at the center of it and trying to zoom out and think about it. And I know for me, it was a huge penny drop moment to look at that and go, and I thought by going on the treadmill for another 45 minutes, I could trump all of that. And that also isn't to say there isn't a place to be on a treadmill for 45 minutes, but it was never going to take me to that cortex in my brain that we actually needed to tap into and truly understand and connect with so that we could get into a healthier kind of space. So the biology absolutely is critical, I think, in this education empowerment moment as well. So keep going. Talk about the biology. Don't stop talking about the biology. I think it's huge.
So my
There's
favorite are the healthcare providers and the teachers because it's a teaching educational moment and it's healthcare. And so I take full advantage with those patients and I will go on until they tell me to stop.
I love it.
That's awesome. We had, I'm just looking at the chat here. We did have a comment. Phyllis had made a comment about the patient has to be prepared to be denied when they advocate. So, like Mike going and putting out these requests for things to be changed. A lot of times it does come back and it doesn't work the way it worked out for Mike. And so you have to be prepared. And she mentioned that she's written to her insurer about the lifestyle category several times and zero impact so far. So I think it's disappointing, and it's unfortunate that that's the case. But I think if we think to the presentation we had with Melody prior to this session, there was a lot of, in order to get that change, there's a lot of perseverance. It has to be repetitive, and you have to keep knocking on the door and not give up. And if enough of us get together and make noise, if they're just hearing it from one, so Phil, if it's just you're the only one that's writing that letter or making that comment, change might not happen. But if we get 150 people writing that same insurer, maybe something can change. Maybe they'll listen to us. Maybe they'll have a more in-depth conversation. So definitely something that we need to work on is getting more voices.
I agree, and it does take time. Like if I think about what the treatment coverage landscape looked like 10 years ago, it is a lot better now than it was 10 years ago. Um,
Mm-hmm.
and I know that, or I'm told anyway, that employers reevaluate their insurance coverage every 6 to 12 months. So I encourage my patients, if they tell me, on day one it's not covered, check again in six
Mm-hmm.
months, and it has changed. So I'm sorry, Phyllis, that is frustrating. And, it's frustrating and it bothers me. But keep trying and
Mm-hmm.
just keep at it, because I do feel optimistic that it will change.
I agree, and I think we've heard that a lot today too. We do know the water will wear away the stone eventually. We hope it's not going to take terribly long for everybody, because as Dr. Socklingham also said, we really are at a point of inflection right now, and obesity care is at a tipping point, where we really do need to start have honest conversations at a systemic and healthcare level as well, to really understand what is it that we're talking about and how do we navigate this together. Because as much as Ian and I were like, God, we feel like we're the only ones talking about obesity a few years ago, now we're like, now just look at us, everybody's talking about it, but they still don't have it right. So there's always going to be that opportunity to continue to educate and inform, all with this idea that it's going to make the traction that we need it to have. We've seen it in other disease states. We know it is possible, and we know that it's only through collective voices that really we see this kind of change in the community as well.
I think there's one thing that I wanted to add, and we've done this in the past with, like, when we went to the Parliament Hill and we had an advocacy day, and what was that? That was 2019, or yeah, 2019 in Ottawa. That was a long time ago, pre-pandemic. But like in all of the advocacy work that we do, we try and there's two important components to it. There's the lived experience, the patient, their experience, and that has some power, that has some weight. Like people will listen to that. It's real, it's honest, it's vulnerable, it's something that has some power. But then you pair that with the scientific background, the knowledgeable expert, the trusted expert, a doctor that has some authority on the science of this, that gives it another level of credibility. So if we're making these asks, we need to pair up. Like it has to be patients and experts working together.
100%. It really, I think, is a team effort where you can pair the patient experience with this, maybe the science and the expertise behind it. I really think that's what gave this situation the, can I use the word clout? Maybe
Yeah,
Mm-hmm.
it needed for a change to happen.
yeah,
Yeah.
absolutely.
Because really what we're talking about here is equitable access to care,
Yeah,
right?
Yes.
and like I said, there's different avenues for it. And when you talk about it being equitable access to care, I've had people reach out and suggest that maybe this is a human rights issue, right? Like if we're talking about certain things, maybe it's a human rights issue. You have, treatments that are being offered for one group of people but not another group of people, and it's, all based on a misunderstanding or lack of
Mm-hmm.
clarity on the science behind it and what we know about it. So I think there's pieces to it that are like different ways we can kind of attack the problem, I think, but
Yeah.
the partnership is definitely going to be important.
And the stories really are the thing that make impact and change, and we know that. And making it humanized and a person that we're talking about as well. We're so used to seeing the obese patient or a patient living with obesity shown as this headless, faceless blob of a person too, right? No, my name is Lisa. This is me. You're cutting me off of my access to my pharmacotherapy that has worked. And what that will result in is me actually becoming a diabetic so that you can give me the drugs that you think I deserve. Let's talk about that because that doesn't make sense. I don't know anybody who I could say that out loud to that they'd be like, yes, that is our plan. That is no one's plan. And I want to believe positive intent. And I want to believe that no one goes into healthcare to do harm. And I want to believe that insurance providers really do want to provide the best for the people that they're trying to cover and that our employers want the same thing. We all want to have a thriving and vibrant community. So that's where I want to kind of take us. And you kind of answered this, but I'm going to bring us home with this one as well, because
Yeah.
it is such an interesting time in space right now to be in this obesity care moment. What excites you about the future the most, or what are you most optimistic about what the future of obesity care in Canada could look like?
Oh, wow. So, I mean, I'm excited about what even has happened in the
Mm-hmm.
last 10 years. I remember when I first started to work in this space, I didn't know the science the way I know the science now. So I'm probably most excited that that has come to light. There's more awareness about the science. And with the newer medications, which are changing the landscape of, how we address this, it is going to become even more important that we understand the science. It's
Mm-hmm.
a beautiful art working in this space, right? Because you really do get to touch on every dimension of a patient's care. You really do get to form a beautiful therapeutic relationship with them. And with all these new medications that are coming out, I really feel like there's opportunities to customize plans to the individual in front of us, so it isn't just a science, it's an art as well, right? And I hope, I do feel very positive and very optimistic that not just physicians understanding, but the public at large, everyone's understanding of body weight regulation, the science of all this, I think it will get better. I'm excited about moving away from commercial weight loss um, programs. I'm excited about moving away from fad diets because I think that just wreaks havoc with people's emotional health and confidence and self-esteem. So with all the new treatments that are coming and these opportunities to educate, I am probably most excited about moving away from that kind of stuff.
Mm-hmm. I love that. I say that often as well because I just think about the collective good that could be brought forward into the world when we help people realize this burden isn't really the thing that needs to define their life and it isn't their burden to carry alone. That really there is so much collective good that we're about to insert into the world by just removing some of this noise and moving away from those fad
and
diet
and
monies and into the science.
and it's happening. We're seeing
Mhm.
younger people that are more informed, that don't go through the 3, 4, 5 decades of commercial programs and fad diets,
Yeah.
so it is happening.
I love it. Well, it's happening because of humans like yourself. So
Oh,
thank you so much for taking the time today. Thank you for all the work that you've done in your clinic. Thank you for what you do every day to help us try and change this narrative and really empower patients to show up for themselves and to show up and help us create a healthier and more vibrant Canada. So thank you, Dr. Walsey. Really appreciate your time and all that you're doing.
well, thank you too for all of what you just said. I think I can give you that same thank you, and thank you for having me today.
Absolutely, a total pleasure.